Hello there, my name is Stan Golovac. I'm an interventional pain specialist. I've been in the field for 38 years now. I've developed and had a passion for radiofrequency ablation. I've partnered with Epimed in order to design and create what we have called the Accura-C needle. It is a very unique needle in that it targets the area that you intend to burn and ablate by utilizing a format of a spritz and a spray that targets the actual nerve itself. So most needles, as you would conventionally know, have an opening at the end, and that opening then forces the fluid or anesthesia to be injected forward into what would be the nerve sleeve, or what's known as the DRG, or the dorsal root ganglion. And so doing so could potentially anesthetize the extremity of where that nerve goes to and innervates. So I thought long and hard and came up with the conclusion that if I were to put small little holes around the end of the needle, I could anesthetize the target instead of the nerve root. So lo and behold, we created a needle called the Accura-C needle. It's specifically designed with a pigtail. And the reason is, once the needle is in place, you actually don't want it to move. So now you can remove the stylet and introduce the probe without moving the needle at all, and therefore allow you to inject local anesthetic additionally to create a larger, bigger lesion. So fluid that is dispersed around the exposed area creates what we call an elliptical circle, an elliptical area of a lesion. The larger the circle, the more area of surface that you have to burn. So if you incrementally add 1/4 of a cc of an anesthetic, you create a larger and larger lesion. But when you do want the lesion to be larger, you want to have that consistency because of the variability of the nerve's location. So we've designed this specifically to target mainly the lumbar, thoracic, and cervical regions. As you know, radiofrequency ablation is a very prominent procedure that can be done consistently. The therapies last between 6 months and 18 months, depending on the regrowth of the nerve. When you explain the procedure to a person, they ask you, will this have to be repeated over and over again? And if you can assure them that you can get up to 18 months worth of relief, a year and a half, the patient walks away knowing that they have a quality of life that can be restored for a significant period of time. From a standpoint of clinical efficacy, it's pretty good.